Presented by the YMCA. Every Thursday on Channel 3 Eyewitness News, live at 5.
The Channel 3 Storm Alert Team, weather coverage you can count on.
Spring is here, the promise of warm weather just around the corner. All of us are feeling a little bit brighter and cheerier. Also a good time to begin thinking about making your smile as beautiful as it can be. So the perfect morning for us to check in with Dr. Michael Hernandez from Chattanooga Dental Care. Good morning to you.
Good morning.
So I know we can talk about lots of things, including the fact that at your office you are very adept at helping people who are afraid of going to the dentist with sedation dentistry. But I want to start, if I can, on the vanity side of things, and that is teeth whitening. Is that okay?
Yeah, sure.
Okay, so I mean, that's kind of all the rage now, right? Everybody wants these bright, gleaming teeth. They're not always so easy to get. At your office, you have kind of a foolproof and safe way to help people get those gleaming white teeth.
Yeah. There's many options for teeth whitening. There are whitening toothpaste, which can work over a long period of time. There's whitening strips, which also can work, but you have to kind of stick with it in order to get the results you want. And you may get some gum irritation from the whitening strips if you're not careful on how you place them. So another great option is to come to the office where we can do in-office whitening. In a very short period of time, you see an appreciable result, a significant change in the shade of your teeth, and we actually are diligent to make it so that the whitening material doesn't get on your gums and irritates your gums. We have some material that we place over your gums actually to keep the whitening agent from irritating your gums.
When you talk about getting your teeth whiter, does it depend on the consistency or whatever of your own teeth? Will everyone's teeth whiten the same way?
If you are starting at a darker shade of your teeth, we're going to be able to whiten them a shade or two. But it depends on kind of where you start at. We're not going to be able to get you from super dark teeth all the way to a white Hollywood smile, probably in one sitting. So everyone's a little different from that respect. But if your teeth are a little bit yellow or a little bit darker than you'd like, we can certainly, for most people, get them up to something that they're much happier with.
Okay, let's talk about flossing. I will go ahead and tell you first crack out of the gate that I'm not good about remembering to do it always. How bad is that if I don't floss every day?
Well, if you're flossing most days, you'll probably be okay. Important to be seeing your dentist every 6 months to keep track of that, and with x-rays once a year, they'll be able to tell you how your teeth are doing in between your teeth, and also they can look at your gums and tell if you're not flossing well enough. But that is going to be important to floss, if you can, every night. If you can make it part of your routine, just like you brush your teeth every night, you can help prevent gum disease in between your teeth and also help prevent cavities in between your teeth.
And do people sometimes have gum disease and they don't know it because it's something you don't feel or see?
Yeah, a lot of dental problems, actually, you don't know about them until they become a big problem. Another reason we tell people to come to the dentist every 6 months so we can catch problems while they're smaller. But you can have gingivitis and it not really be that apparent because you may not feel anything. You may be able to look closely and notice that your gums are a little bit inflamed or red, but there's not necessarily going to be pain with that.
And if that's the case, if you have gingivitis, how do you treat that, or can it be treated?
So gingivitis is usually, you can keep that at bay by cleaning your teeth well and flossing well. But over a period of months, most people, the vast majority of people, will accumulate some tartar around their gum line, which can't really be brushed off. Once that tartar is there, it holds bacteria and makes it so that you'll have some gingival issues, gingivitis problems, or possibly even worse, a condition that's kind of the progression of gingivitis called periodontal disease. So that's why brushing, flossing your teeth is important, but also coming to the dentist every 6 months so that your hygienist can scale those tartar buildups off and help keep your gums healthy.
Okay, so that leads us into the sedation part of things, because a lot of people are afraid to go to the dentist. You can help them with that because you can ease them while they're there.
Yeah, we are a sedation practice. We have multiple options for getting you sedated, which is a problem for a lot of people. Some studies have guessed that there's possibly between 30 and 50% of all potential dental patients, so people that have teeth, who may not go to the dentist because they're afraid of going to the dentist. So we have a very calming environment. Our staff is all very caring and nice. There's no judgment in our office. We are there to help you wherever you are, and lots of people have been avoiding going to the dentist for some time and have some dental problems. We can help get them relaxed and help take care of their issues.
Well, let people know how they can find you. It's Chattanooga Dental Care, conveniently located right there on Shallowford Road. The phone number is 799-4008. The best thing is to hear that it's judgment-free. So if you have been putting it off, no need to feel any kind of guilt or shame when you walk through those doors. Just let them help you get that smile you want. ChattanoogaDentalCare.com is the website. Thank you, Dr. Hernandez.
Thank you, Julie.
We're experiencing